At this time, I have the pleasure of introducing our moderator for this morning. She's an award-winning journalist with a passion for education, storytelling. She spent 29 years at WXIA-TV, 11 Alive News, the NBC affiliate, where she created the award-winning Class Act and Class Note segments, which allowed her to honor hundreds of Metro Atlanta teachers while giving her a unique view of education in action. In her new role as the communications officer for Fulton County Schools, she continues to spotlight the innovative, creative, and exceptional news taking place inside our classrooms. She is a recipient of numerous awards, 9 Emmys, and 3 Gabriel Awards, to name a few. She holds seats on several boards and has membership in many professional organizations. Many of these are tied to advocating and supporting our young people in our community. Without further ado, help me welcome Ms. Donna Lowry.
Thank you. Good morning. Good morning. Oh, that was actually enthusiastic. Good morning. Let's hear it again. Very good. I'm thrilled to be here today. This is such an important issue that we're going to talk about today, mental health, mental illness. Statistics show that 1 in 5 children in the U.S. show signs or symptoms of mental health, of a mental health disorder in a given year. 1 in 5. Yet nearly 80% of children who need mental health services don't receive them. Parents and caregivers often don't know what to do to help a child who is struggling with a mental illness. Today, we will all talk about a lot of these mental health issues and the mental health crises affecting children and families, and the signs for us to look at home, and how to partner with schools and community partners, and we have a lot of them here today, as you saw as you were walking in, community agencies, on how to address mental health concerns, also with your schools. So this forum is one of the results of the Fulton County School District's efforts to collaborate with the community on matters that affect the whole child, such as school safety, emotional intelligence, emotional well-being, and student achievement. I am delighted to be included as a moderator of this event because I think it is so important, and it is another reason why we are videotaping this event today. Because as the person who deals with the communications department and everything with communications with the school district, these crises often land in my office. So I think it's very important. So before we go any further, I have a few introductions I want to make. Please join me in recognizing a very special person who's here, and you see a lot in the community because of her passion for what she does. She is a school board member with Fulton County Schools. Please join me in welcoming and thanking her for being here, Ms. Kimberly Dove. Are there any other elected officials present? If so, please stand. Okay, anyone who wants to be an elected official? Okay. Just before I introduce the panel, let me thank each one of you for being here. As I said, I think it is important, this is an important topic, and you are to be applauded for your willingness to come out on a Saturday morning, get out of your beds, and get here because you know that this is important, that you care about your students, your schools, and your community. So we are glad you're here. Let's give yourselves a round of applause. Let's do that. So I get to introduce this distinguished panel, and we are thrilled that each one of them came out today. So I'm going to start on the far left, my far left, your far right, Dr. Sherry. Dr. Sherry Blake is a licensed clinical psychologist with more than 30 years and more than 100,000 hours of direct and indirect service. Dr. Sherry earned her PhD in clinical psychology at Vanderbilt and her master's from Vanderbilt after graduating summa cum laude from Tennessee State University. Dr. Sherry has been seen on some of the top-rated reality TV shows, as well as numerous other TV networks, radio, print media, CNN, ABC, CBS, and NBC. And She is very much a part of this community. I had the pleasure of getting to know her and interviewing her while I was at Channel 11. She has written a book called The Single Married Woman, and she has a weekly column with Essence.com. Please join me in welcoming Dr. Sherry Blake. Next, Dr. Sultan Sims. Dr. Sims is a psychiatrist and behavioral health medical director for WellCare. Dr. Sims completed his undergraduate education at Yale and earned his medical degree at Morehouse School of Medicine. Currently, Dr. Sims is the administrative and clinical lead of the market behavioral health programs at WellCare Health Plans, Inc. for Georgia and South Carolina. Please join me in welcoming Dr. Sultan Sims. Next, Latrina Foster. She's director of the Fulton County Department of Behavioral Health and Developmental Disabilities. Ms. Foster was named the director of the Fulton County Department of Behavioral Health and Developmental Disabilities last year after working for 10 years in that department. She holds a bachelor's degree in psychology from the State University of New York College at Buffalo and a master's degree in professional counseling from Argosy University, and is currently working on her doctorate in business administration. Please join me in welcoming Latrina Foster. Dr. Vita Johnson is a school-based health center pioneer, so let me tell you about her. Dr. Johnson is the Marcus Professor in General Academics and Pediatrics and Director of Partners for Equity in Child and Adolescent Health for the Department of Pediatrics at Emory University. As the prior director of that organization at Emory, Dr. Johnson pioneered 2 school-based health centers and 2 community-based health centers serving underserved women and children in the Atlanta metropolitan area. Under her leadership, the number of school-based health centers in the state has increased from 2 to 31 in the past 5 years. Please join me in welcoming Dr. Vita Johnson. And we are pleased in Fulton County that we have 2. That we have one at Lake Forest Elementary School and College Park Elementary School. And last but certainly not least, one of my favorite people since I began working 6 months ago with Fulton County Schools is Dr. Candace Ford, Executive Director of Counseling, Psychological, and Social Work Services for Fulton County Schools. Now, Candace Ford serves in that position as a school psychologist by training and has her primary interests in school safety, social emotional learning, and wellness. She is particularly passionate about leveraging relationships to establish a positive school climate in order for students to benefit. Please join me in welcoming Dr. Candace Ford. So, we have quite a distinguished panel here, and I want to get started, and we're going to allow some time for your questions in the end. Although what I'm told is you have been given pencils and cards, I believe. Raise your hand if you have them. Some people have them. Pencils, okay? So I think you're going to get cards or something to write them on. If that doesn't work, we'll have you stand, but we're going to make sure they're questions and that this goes quickly. I'm going to ask some questions of each of the panelists. Audience, if you have a specific question, as I mentioned, we're going to try to get you index cards. And then we may have some further discussion. Some of you do have index cards. Inside your folders. Oh, I got it. It's inside your folders, I've been told. So look inside your folders. Lots of good information there and an index card to go along with your pencil. All right, I'm going to start with you, Dr. Blake. How are mental illness, I can say this, it's Saturday morning. How are mental illnesses diagnosed in young children? Talk a little bit about that, how we even find out about a mental illness in a child.
Thanks so much. That's a great question. Good morning, everyone.
Good morning.
You know, with young children, I try to be very careful in diagnosing young children because so many different things go into place. So we have to look at what is within a normal range. So with younger children, we start looking at the developmental, and you have to start early. I am very careful not to stick a label on a child unnecessarily. So sometimes it's a developmental issue, sometimes it's a situational issue. So what we have to do is really look at all the issues and do a holistic approach where you look at what's going on at home, what's going on in terms of school, if it's a school-age child. A lot of times people, the kids are diagnosed younger and younger, as we all know now, but you want to make sure, how is your child developing and progressing compared to other children their age? So when they get to a certain age, we do some testing. We do psychological, psychoeducational, or whatever is needed, developmental tests to see where is that child falling compared to other children. So it's very important for you to look at not just what's going on within the school setting in terms of making an assessment, but what's going on in the family, what's going on in the community. If you notice your child is playing, but the play is overly aggressive, if you notice that something's not quite right, then you want to sort of start talking to others around you. And sometimes other people are already telling you, but sometimes people are in denial. So kids will go on for a long time without getting the proper diagnosis. And so we have to be very careful, because when I do an assessment and when I make that or before a diagnosis is made, I really want to know, how is that child behaving in other settings? Is it just one setting? Is it a variety? Is that behavior consistent across the board? So we look at patterns. We look at what's the norm compared to other children within that age range. And then we do some testing, and then we look at, again, the whole picture before a diagnosis is made.
Oh, thank you very much. Obviously, what you're saying is it's not just one thing,
not
one way of diagnosing these children.
Right.
Okay, we're going to move on a little bit and talk, and we'll get back with you. We want to talk a little bit about schools and children, and we have up our banners about student achievement and community collaboration. But student achievement is often tied to how well a child is able to function mentally. So, Dr. Candace Ford, I want to talk about what are the challenges that schools in particular can present for children struggling with an emotional or behavioral issue. Is your microphone on? Let's see. Okay, the light is on. All righty.
Is that better?
Okay. We'll work with you.
Can you guys hear me? Okay, I'm just going to speak audibly. I'm going to use my theater voice.
Okay.
So sometimes it's very difficult to parse out what's going on with kids. And so we have counselors, social workers, and school psychologists in all of our schools to help teachers understand the root cause of behavior. Many times in schools, children present, they may be off task, they may have truancy or have difficulty attending school, their grades may be compromised, but it's our job to look at the underlying reasons regarding the why behind that. So many times kids who may be experiencing anxiety or depression, they may appear to be aloof or disengaged, or if students have historically maintained average or higher grades and all of a sudden we see a dive in their performance, we need to take a closer look and determine, is this purely academic in nature, or could there be an underlying emotional concern that we really need to take a closer look at? And as a school system representative, I would say that takes all of us looking holistically at the child. It takes parents being aware and knowing your child, because you know your children far better than we in the school system do, but communicating with your school counselor, your child's teacher, to say, hey, what have you seen? Have you noticed a change in my child's affect or behavior? And then let's come together to piece together what we need to do to provide aids and services to that student, to support that student before problems get worse. So to answer your question, we can see dips in grades, dips in attendance, increases in discipline referrals sometimes are a marker. And we want to pay attention to those changes and ward those off the past by getting proper identification of those children so that we can help them function and maintain not only their academics, but most importantly their basic needs and social emotional functioning.
Thank you very much. I'm going to pass along this microphone if we can't get our microphones to work here, so I may be walking over to you. Next, Dr. Sims. So what we want to know are, how are children with mental health problems treated? Let's see how you sound.
Can you hear me?
Can you hear me?
Sounds
Okay.
like it's on.
All right, you sound good.
All right, so how are children with mental health problems treated? Was that the question?
Yes.
So there are a variety of ways that we can treat children. I'm a physician, I'm a psychiatrist. One of the things that differentiates me from the continuum of providers is my ability to prescribe medicine. But that's not the only type of treatment that's available. And it's definitely not the first type of treatment that you want to go to, especially with young people. We have psychologists up here, a licensed professional counselor, there are social workers, there are members of the community. Some people are very connected to their church, and there are maybe pastoral counselors in the church that are available. So there's a whole spectrum of types of treatment that are available. And you really want to tailor the treatment to the needs of that particular person or that particular child. Ultimately, we've heard a little bit about looking at everything as a whole, taking everything in context, looking across settings. And in psychiatry, it's really about functioning. How is this person functioning? What are their symptoms? How are their symptoms impacting their lives, and how are their symptoms impairing their functioning, whether in school or at work or at home and in interpersonal relationships? We really want to look at that when we're evaluating anyone, and we're talking about mostly children today. So when we're evaluating a child, that's where we really want to focus. And so hopefully we're able to get that person help, address their needs through counseling. That's coming into someone's office, sitting down, having one-to-one counseling, and having an open, honest conversation about what's going on, how they're feeling, the struggles they're having in their lives. Adolescence is a difficult time. School can be a difficult time for a lot of young people. There are a lot of challenges, whether socially or academically. The home environment, which is where our children spend most of their time. I guess it's mostly school and at home. So there can be challenges at home. So you want to sit down with someone in a counseling environment, in a safe environment, and really try to get at those issues and see what can be done to change the environment and create an environment that's more supportive and then allows that young person to succeed. Hopefully that's enough, sometimes it's not. And so there are times where counseling, healthy diet, exercise, your spiritual practice, there's some times that those things are not enough to address the issues. And so going to see a psychiatrist, maybe getting an evaluation to see if medications are appropriate, that's something that we shouldn't, it's something that's a part of the continuum and something we shouldn't shy away from. Again, it's not the first choice, but it's definitely something that we don't want to shy away from. Too many times in my career, I would see a young adult, someone 18, 19, 20 years old, who struggled all through their adolescence. And there was maybe a medication intervention that could have really helped that young person. And they would come to me and express a lot of frustration and sometimes anger with their family that they didn't get them the help that they needed. So I do want everyone to be open to the idea of medication if it's really something that's necessary. And then beyond that, when it comes to a medication evaluation, you want to sit down with your psychiatrist, have an open conversation, get a real sense of what the needs are, what the symptoms are, have a clear conversation with mom and dad and the child about what the medicine is for, potential side effects, the upside and the downside of the medicine, and you really want to have a collaborative kind of decision. If you ever walk out of a psychiatrist's office and you're confused about what is being done, you're confused about why you're taking a particular medicine, why he or she prescribed it, then it's time to, that should never happen. Maybe you need to see another psychiatrist, maybe you need to get another appointment and have more conversations. What I really want to encourage you to do is ask questions. It's my job, it's any psychiatrist's job, to explain things to you in a way that you can truly understand it. There shouldn't be any confusion when you're done. So I think those are all the things that go into making treatment decisions.
All right, thank you very much, Dr. Sims. So not everybody can afford to go to a psychologist or a psychiatrist, and so we need to know what some of the resources there are available to us. So now I'd like to talk with Ms. Foster about that, in Fulton County in particular. What resources are available to families and parents, you know, to the students, for the students who might be suffering from some behavioral or mental health disorder?
Great question. Can you hear me?
Yeah.
All right. So treatment is available for everyone, people that have insurance, people that do not have insurance. And so your question is directed to individuals that perhaps are uninsured or underinsured. And so Fulton County government, that is our main focus, is to ensure that people that do not have insurance or that are underinsured have access to care. And so we have facilities where if you do not have insurance, or if you have insurance that will not cover mental health treatment, we are able to provide you with services. So don't ever think that because you cannot afford mental health services, you can't receive mental health services, because mental health services are available. The state has also provided funding to various agencies throughout the county to ensure that individuals have access to care. As you know, in some schools we have therapists placed in the school, which is a free service to that student, and that's through the APEX project, which is a state-funded initiative where we're placing therapists in the schools where students do not have to miss school, but they can access treatment while they're in school and speak with a counselor if needed.
Thank you very much. Dr. Johnson, I want to get into, so we've talked about what mental health issues you might find in a child, but how do you know that it might be time for you to get some help? What are some of the signs that you might see in a child that tell you it's time to maybe ask some questions of a professional?
Oh, good morning. I don't know if you can hear me. It's red, but I can speak kind of loud.
No, green. It needs to be green.
Oh,
I think you're on.
Now? Oh, I guess you can. So it's great to be here and be on this wonderful panel and to talk about a subject that's near and dear to my heart. So as a pediatrician, you know, we are always, from the time a child is born until, you know, we no longer care for them, we're always looking at the whole child to determine what are the issues that are impacting them and that are prohibiting them from maximizing their potential. I want to emphasize, I think Dr. Blake brought it up, that not every behavioral health, every behavioral issue is mental illness, right? Because children actually react to situations, they react to just normal developmental responses to things. You know, one of the ideal ones is when a new child is brought into the home. A child in the home may begin to have behavioral issues. They may regress to wanting to drink out of their bottle or wet their bed, but that's normal. Children respond to loss. They respond to parents who divorce. They respond to some exposure to violence, but that doesn't mean that they're mentally ill, but they may react. However, you know, there are a lot of cues to children who are really in trouble. And I want to sort of deviate a little bit because I think this is really important to note. Our children are exposed to so much garbage in this society that their capacity to process all the things that are coming at them really cause them to react adversely. Every child has a cell phone. Every child basically has a TV in their room. Every child has access to internet. And our children are being exposed to issues that are really dramatic and are really impacting their psyche and their ability to process the information that's being thrown at them. We have cyberbullying, we have exposure to pornography, we have all of those things that directly impact the well-being and the normal emotional development of children. And it really is up to us as adults, as parents, as teachers, as pediatricians, as medical providers, to have a discussion around how do we protect our children from these exposures. Because currently, those exposures are probably the most important factors that really contribute to a child having emotional and behavioral issues. So having said that, I'll get off my stump speech, but I wanted to bring that up because I think that's incredibly important. But when you see a child sort of escalating in their behavior, if you see a child whose behavior is basically escalating no matter where they are, sometimes children react to the environment that they're in. Sometimes they react differently when they're going to school and they don't want to be separated from their parent. They may act differently at home when they are with their parent. But if you see a child who actually, his behavior escalates no matter where they are, whether they're in school, they're in home, you're out shopping, wherever they are, they're basically reacting in a very negative, aggressive manner, then you know something is going on, and it's something deeper than a child who's reacting just to the situation around them. We know when children start doing things like self-harm, like banging their heads, or injuring themselves in ways that seem to be abnormal, or with adolescents cutting themselves, then you know that these children are really experiencing some emotional issues that are leading to adverse behavior. We know that children who become very withdrawn, who no longer want, the teenager who goes into the room and stays in their room and never comes out to interact with their families. We know something is going on that's a lot deeper than just reacting to something just a normal stressor. We know that little ones who withdraw and who do not interact with their families, who seem to be excessively sad and hopeless, we know something is going on with them. And finally, if we see children who are talking about suicide, which is huge in our community these days, you don't overlook that. You don't brush that off. You engage that child in such a way, in a very, very meaningful way, in order to determine what it is that's causing them to be so sad and lonely. There are other signs and symptoms, but I think the issues of being withdrawing, for those who really want to harm themselves, and then sometimes you'll hear, some children will say that I hear voices and someone's telling me to do something wrong, you know that they're experiencing some severe mental health disorders. So we need to be on the lookout, we need to be vigilant, we need to protect our children from a lot of the issues and a lot of the factors that they are being faced with in today's society, so that it doesn't escalate into severe mental illness. A large number of our behavior issues are reactionary, a large number. I always call them V codes. I would say probably 50 to 60% of the aberrant behavior that we see in children are not DSM-5 diagnostic mental health disorders, but nonetheless, it's still impacting the child's ability to function and to do well in life. So it's up to us to be vigilant and to look out for these things, and also to try to help prevent them by making sure that we're monitoring what our children are seeing and what our children are doing and what our children are being exposed to. And with that, I'm through.
All right, thank you, Dr. Johnson. It occurred to me that a pediatrician is the place to start for a lot of parents. And so we go for child shots or other things, but we may not think that with a pediatrician we're supposed to ask some questions dealing with mental health issues also, but it's a good place to start.
Well, I just want to say, so we screen children as well when they come in. From the time that they're born, we start screening them for psychosocial issues, starting at 6 months of age, and we have different instruments that we use to screen them based on their age and development. And so it really is our responsibility to be at the front line trying to identify these children who really will get into trouble.
All right, thanks. Dr. Sherry, let's talk about something that Dr. Johnson touched on, and that is dealing with the teenagers and the fact that you may think that they're experiencing some things as a parent, but then you've got a teenager who's going to fight back against you. So how do you discuss issues of possible mental illness with a teenager in order to help them get help?
Well, if you're a parent, you probably think all of your teenagers, and especially if you have teenagers, you say, hey, they got a problem. Because they have enough stuff going on just being a teenager that you sort of look at them, as someone told me, through the side eye. Because you say, who is this child? But on a different note, because I hear echo, but on a different note, what we have to do is, when we have teenagers and we know that we're seeing a problem, keep in mind that problem didn't just pop up usually as a teenager. We start seeing the isolation or having difficulty with friendships and interpersonal relationships. What you want to do is be involved in your child's life, because it's so important to, I don't care if you want to hear what they're saying or you don't want to hear, you have to listen. because it's only through listening that you're going to start really hearing what's going on. And they will tell you, directly or indirectly, resistant or not resistant, they'll tell you they don't want to talk to you, but if they tell you, and they used to talk to you all the time, then you start looking at it quite differently. Also, look at the pattern in terms of who are their friends. Have they changed friends lately? Are they secretive? All of a sudden, they come in the house and they shut the door and they won't come out ever. But when you know there's a problem, and you know there's something beyond just being the hormones of the regular teenage, then you're going to have to get help. You got to keep in mind that you're the parent. What you want to do is approach them just like you approach, well, not just like, because I don't know how you approach them, but you want to approach them in a non-threatening manner. So it's, again, a lot of times people won't tell you, the kids won't tell you they have a problem because of the shame, the stigma, and all the other issues. A lot of kids, most kids want to be accepted. So they won't tell you that they're hearing voices. They won't tell you they're cutting themselves. But you've got to be very, very aware as parents. You've got to be very vigilant. And what I say to you is start looking. You know, people say, well, that's their room and I won't go in it. Go in their room.
No, that's right.
Go in their room. Start looking at the type of music they're listening to. Who are their friends? What's going on with them? And engage in conversations. And not conversations where it's an open-end question, where it's a yes or no answer, where there is conversation. And you can do it through TV shows. If you're watching TV, look at what they're picking up. Are they only picking up on the negative? And then start talking about it's okay for us, we need to talk with someone. And you may have to be a part of that process initially. A lot of times children will not, and especially teenagers, won't talk with parents because they think all parents are crazy. They think we all have lost our mind and we know nothing. But a lot of them are hurting and they really do want the help. So what you have to do is be a part of that process of them getting help. Look at the language that you're using. Be careful in terms of saying, well, you just act like you're crazy, or you act, and we use that term very loosely, but it pushes them farther and farther back into their shell. And so what you want to do is be a part and let them know that mental health is just like physical health. If something was hurting you physically, I would not ignore it, and I cannot ignore the fact that something is going on with you now. And if you don't want to talk with me, that's okay, but we're going to find someone for you to talk to and share this, whatever is going on with you. And if it's nothing, you can tell them it may not be anything, because you take them off the defensive. It may not be anything, but I'm not the one to decide. I'm concerned about you because I'm going to love you regardless. And as long as they know they have that support and you are trying to get help, just like with anything, usually that resistance will start being, you'll see less and less of that. And once you see less and less of that, and if you can find a window of opportunity, do it. But if there's a serious issue where you think they're going to hurt themselves or hurt someone else, remember, you're the parent. Take them just like you would take them to the doctor if there was a physical problem and you thought they were diabetic, or if you thought something else was going on, you would take them to get help. And do not feel guilty or guilted out about it. I have parents that's very funny. They come in my office and they'll say, he didn't want to come or she didn't want to come. And the kids say, I'm not talking to you. And I said, okay. But as trained psychologists, psychiatrists, behavioral, we know how to get them to talk. So don't let that be your issue, let that be our issue, because we can do it in so many different ways. We will meet them where they are. I don't care if it's through the music, through the art. Sometimes I have learned more about video games. I have children, I'm an empty nester now. Actually, I'm a grandmother too. But anyway, as an empty nester, I had to learn a long time ago when the kids were going through that phase, listen to the music you really don't want to listen to see where they're coming from. Listen to the type of conversation. So when they get to the doctor's office, you already have an idea of something's going on. You may not know what, but they will open up. And do not ignore comments about suicide, and I cannot emphasize that enough. And I have to share this very quick story because especially within the African American community, we have such stigma and we ignore things until we're in a crisis situation. I had a kid that had made a comment that he wanted to kill himself. And the school got whip of it, and the counselor, they will not allow them to come back until they have an assessment sometimes, if they feel it's serious after they've done the initial screening. So the parent was forced to bring the child in. It wasn't that the parent said, I need to bring him in. The child had been making little comments for a while. The child gets to my office, and it's on a Tuesday, and they had put him out of school on a Wednesday the week before. So it took her from Wednesday to Tuesday to get up enough courage to say, okay, I need to bring him in. She brings him in. The child's 13-year-old African-American male. And she tells me about all the other things that she thought was a problem with this kid. He won't clean up his room. He won't do this. He won't do that. He won't do this. Now, at this point, I don't know that the school has dispelled him. And at the end of this hour intake, she says, yeah, and he says he's going to kill himself. And I said, oh, he did? Let's back up a little bit because I'm taking note. Then she tells me, I says, you know, I started asking questions. And I asked her, I said, well, have you talked to him about this? Have his father talked to him? Yeah, you know, no, I hadn't told his dad. I told him they put him out of school. They lived in separate households. And then she said to me, she says, but I did tell him I was bringing him to you, and I told him, boy, you better not, because I asked him about him making this comment, and he said he wanted to hang himself. And I said to him, boy, you better not hang yourself. I don't want to come home and have to take you down off of a clothes rack, because he told me he was going to do it in the closet. I don't want to have to take you down. So, boy, I told you, you better not do that. That was her answer. So a lot of what I do is educate the parent. Educate the parents of the telltale signs. What is it that you're seeing that you may ignore? But when you do hear something, how do you respond? Because this child had a plan. This child had attempted before. And this child, he was very clear. And you cannot ignore those kind of things. So I say with teenagers, yeah, they can be tough, but you got to be tougher because you're a parent.
Wow. And that's why we have the parents here, for the education part of it, and to tell your friends and make sure that we're all aware of this. Candace Ford, I want to talk about the school district's role now. I know Dr. Blake alluded to it a little bit with this particular child, but overall, what is the school district's role in terms of a child with a mental disorder? I don't know.
Whenever we hear that a student is a risk to himself or others, what is it with me in this?
I don't know, but I'm going to give you this one.
Thank you. So when a student presents as a student who may be one to exhibit harm to himself or to other people, when we first hear about that, we've trained our staff to contact the school counselor, the school social worker, or the school psychologist, and we do what's called a student crisis response protocol. And so when we start that process, we ask questions and we get more information about that child's intent, ideation, access, and such as those things. And when we are asking those questions, simultaneously another person is calling the parent or guardian to have the parent or guardian come to the school, because we take this very, very seriously. We do not want any of our students to harm themselves or other people, obviously. And so we take it very seriously, and then we strongly advise and encourage that our parent seek attention for the child by using some of our immediate mental health resources. Now, there could be some miscommunication about this, but school districts cannot require an assessment in order for the child to come back to school, particularly in an evidence in a situation where a child may be presenting signs of suicide. We can't just say, see ya, good luck with that. We refer out,
We partner with our providers. We encourage family members to get a release of information signed so that we can communicate with our outside partners, because we can't act in isolation in situations like this. And there are some cases, if a child makes a threat to another person, that child might be faced with suspension, which could be a different matter entirely. But I just want you to hear that we welcome your children at our schools, and we want to put in crisis plans for them if they evidence some of those characteristics of harm to self or harm to others. We want to make sure that we're communicating with parents about what the concerns are. We do not want to put anyone on the defensive, because it can be a very isolating thing to be a parent who's called by one of my staff members to say, hey, your child is saying A, B, and C. And the parents oftentimes are working multiple jobs sometimes. And it's very difficult sometimes for parents to come to the school to receive their children. And we realize that. But we also realize that it's our duty to protect children, to have schools be safe. And so we need your partnership to help us identify those needs and to act accordingly to get the child the help that he or she needs. And so we have school counselors, school social workers, and school psychologists who all play a unique role in addressing those concerns. Another role that school psychologists play is if your student is having academic problems or behavioral problems at school that you're concerned about, we can initiate a process that's called Student Support Team, where you can ask to meet with your child's teachers, the school psychologist, the school counselor, whatever party is appropriate to help address your student's needs. And that's a function of general education. And as we try to deploy interventions to help students who may be having academic, social, interpersonal, or academic needs, when we deploy those interventions, our hope is that the child gets better and that we see some collaboration with our systems between teachers and parents and mental health professionals in the school building. If we do not see that improvement, however, it could be that that team of individuals and the student support team refers the student for a psychoeducational evaluation that our school psychologists would perform to dig a little bit deeper to say, hey, what's going on? Could there be some other underlying things that could be impacting this child's educational experience adversely? And it's very, very important to remember that an educational experience is not just academic performance. It's how that child relates to other kids, how your student relates to adults. Do we have friendships? Is the student involved in extracurricular activities? All of that encompasses educational performance. It's not just about the grades on the report card. And so it's on all of us to work together to use a systems perspective to identify mental health needs in children and to support and scaffold that process through evidence-based interventions in our school systems.
Right, thank you very much. Come and get the microphone. Thank you. And Dr. Sims, I want to talk to you a little bit. I want to get back to the whole issue of medication, right, in children. So when should a child get on a medication, be put on a medication, and for what reason specifically should that happen?
Well, it depends. Is this on? Can you all hear me?
Okay.
On?
I'm right here for you if you're not.
I think it's on. It depends. So I wish there was an easy.
I'm going to give you this.
It's not working. I wish there was a simple answer to that, but I can't really say it's a kind of a simple yes/no type of response. It really depends. It can depend on the level of impairment in functioning. It can depend on the particular condition. There are some conditions where non-medication interventions can be very helpful, can be very effective, and can totally respond to what's going on. There are some conditions where I think it was Dr. Johnson mentioned a child talking about hearing voices, hallucinating, being paranoid, being psychotic. A psychosocial or counseling intervention is not going to be enough there, very unlikely to be enough. Or someone who, with bipolar disorder, is characterized by mania and depression. If someone is manic, if they haven't slept for days, if they have a lot of energy, they're very agitated, very aggressive, they're very impulsive, they're making reckless decisions, just going through some of the symptoms of mania, you want to, that person is likely to need medications and need them quickly. You want to stabilize that person. Someone who's severely depressed, and you know, we've talked a little bit about people being depressed, feeling kind of sad, down. Maybe you'll notice appetite changes, not a lot of energy, impairment in concentration, even suicidal. You know, you may see some of those symptoms, but if it progresses, if it's lasting for an extended period of time, if they're expressing thoughts of suicide, if they're engaging in self-injurious behavior, if, along with the depression, they're having psychotic symptoms, then we might need to go to a medication. It all depends, you know, how effective are the non-medication interventions, even with a condition like ADHD. There are non-medication interventions that we can do with ADHD, with counseling, cognitive behavioral therapy, just addressing the environment. Maybe there are things that the parent can do. Maybe there are things that in a school setting that can be done to address those ADHD symptoms. But what if those things don't work? We know there are medications for ADHD that are very effective. And you know, you only get one chance to be an adolescent, to be a child, to go through school. And what happens in those 18 years of your life can have a major impact on the next 50 or 60 years of your life in terms of school performance, where you go to college, or what kind of jobs you get, what kind of opportunities you get. You only get one chance at that. So you want to do everything to put that child in the best position to succeed. So it really all depends. And when we're taking a history, when we're evaluating someone, these are the things that we're assessing. We're assessing their symptoms, the level of severity, the home environment, the school environment, the interventions that have taken place up to that point, and how effective or ineffective they've been. And so we may decide that, you know what, a medication is really needed here. It may be a question that comes up is, how long am I going to need to be on this medicine? Again, it depends, but it might be a situation where you only need to be on the medicine for a short period of time to get that person stable, to get them functioning well, to allow them to participate in those non-medication interventions. You know, if you're so depressed and despondent or manic or psychotic, asking that person to sit down and engage in counseling or psychotherapy may not make sense. It may be unlikely to work. So you may want to have someone on a medication for a short period of time. Again, depending on the condition. You know, conditions like bipolar disorder or schizophrenia, where there's chronic psychosis and chronic mood symptoms, those conditions are going to likely need chronic medication management. And what we want to remind people of is there are a lot of health conditions that need chronic medications. You know, type 1 diabetes, people develop with seizure disorders or cardiovascular disease, hypertension. There are a lot of things that we need. There's a lot that can go wrong with the body. So I don't think we should look at medication in behavioral health conditions any differently than with physical health. So all of those things it's a complex answer, but hopefully that answers the question.
Ms. Foster, and first of all, before I get to you, I want to ask if you have questions. I think there's somebody picking up the cards you might have on cards right here. Raise your hand if you have a card, and they're going to bring them up to me. so that we can get your questions in. Ms. Foster, I wanted to talk with you a little bit about, so when I think of the health department and some of the things you guys provide, what happens when it comes to the people who can't afford the medication? Are there resources available?
Yes, so absolutely through our, maybe all of
You think you're
hello.
on? Okay, just go ahead and take this.
Everyone that is in the audience is like, those guys need some education on IT, but it's really not us. So absolutely, there are resources for individuals that come in to receive services, and if they meet with a psychiatrist and it's determined that medication is necessary and an individual cannot afford the prescription, Fulton County government ensures that we have resources available where you are able to get your prescription, where it's not going to cause a financial burden on the family. And I wanted to add something to what Dr. Sherry said earlier about comprehensive treatment, and I believe Dr. Johnson said it as well. And when they refer to comprehensive treatment, it doesn't mean that you're going to just drop your teenager off and say, hey, fix them, I'll be back to pick them up. It's a comprehensive approach where we work with the family as well, because at times the family will have to implement interventions in the home to ensure that the child has the necessary support and stability to improve their behavioral health needs.
Before we get to your questions, unless
You want me to?
for me, sorry.
Sorry, I'm sorry.
Where are you with the questions? Okay, she's going to bring them up. And while they're bringing them up, let's talk a little bit, Dr. Johnson, about something that children may introduce into their lives that may cause problems, and that we're talking about drugs, right? Not the type that medically, that were used medically for disorders, but everything from marijuana to the opioid crisis we're dealing with, that kind of thing. So what are some of the symptoms, some of the things, the behaviors we'll see that indicate to us that our children are introducing things into their bodies that are creating the crises?
I don't know if you could.
Go ahead.
So, you know, I'm a child of the 60s, so I should know a lot about marijuana. But I don't, okay, so I only tried it once, but don't share that with anyone. But we do know that it's not that it's making a comeback, it's just that it had sort of gone unnoticed for a while, and that it's becoming a lot more prevalent, along with some of the hardline drugs, such as opioids, such as cocaine, such as heroin. And, you know, the thing about marijuana, people think that it's a pretty safe drug. Well, I guess when you compare them to the others, they are fairly safe. But they do have a profound effect, especially on the adolescent brain, because the adolescent brain, as we know, hasn't matured and is still under construction. Everybody knows that if you talk to an adolescent. They're very concrete thinkers, and they have a tendency not to look at long-term outcomes and consequences. And so they live in the here and now. And so their brain is undergoing construction, and marijuana can be very, very impactful on that brain that's actually undergoing construction. It affects their memory, it affects their judgment, it affects their emotional stability, and also affects their appetite, you know, because everybody's stacking when they're smoking pot. But if you don't recognize that even though these are sort of short-term impacts, that marijuana and some of the other harder drugs can really affect the cognition of children, especially their IQ, it can affect their decision-making, and it can affect their relationships with one another. So if you're a teenager who has been fairly outgoing, engaging, good peer relationships, good relationships with others around them, their siblings, and all of a sudden they become very withdrawn and seclusive, then you should be aware that that's usually the symptoms that something is going on, and they may be abusing drugs. If they become very aggressive, if they start doing things that are very much out of the norm for them as far as their personality and their reaction to stimuli, then that is a suggestion that they're undergoing drugs, that they're actually taking drugs. One of the biggest challenges that we have now is children's not exposure to drugs, but their ability to get drugs. right? And so we have a lot of families who may be on pain medications, who may be taking drugs for therapeutic reasons, and then they find that their children realize that this is a way to sort of escape from whatever it is that they're dealing with. They have a tendency to abuse the drugs that the parents have, and so they have more access to drugs than they have had in the past. So if you know that, if you notice that some of your medication is missing, or that if you can't remember where you put it, and then you realize that there may be an issue with your child having access to your drugs, then you should talk to them and you should try to find out if they truly are taking the drugs. But it's usually mainly around personality changes. It's around the way that they engage with one another and engage with those in their family that gives you some hint and some clue that they're taking drugs. Children who have done really, really well academically and all of a sudden they're failing. Children who, like I said, who never go out and they're very seclusive. Those are really strong warning signs that these children are involved in taking drugs that may affect their outlook on life and their ability to relate to one another. So once again, you just have to be really vigilant. Everyone has sort of given you that message that we need to be watching our children and monitoring what they do, how they act, and how they respond to things that they normally would respond differently to. And it's really up to us, because oftentimes, most times, they're not gonna come out and tell you. You're gonna have to be like someone who actually goes in and investigates everything that your child is doing. So it's really up to us to sort of monitor them. It's up to us to intervene. It's up to us to get them the help that they need. It's up to us to make sure they don't have access to these drugs and these and these stimuli that really affect their lives adversely.
Thank you very much, Dr. Johnson. Dr. Sherry, I believe you were given a card, a question, and I think your microphone was working. Let's see.
I think it is.
Okay.
I think I'm the only one.
Okay.
I rigged it. No. The question is, last year the Netflix series 13 Reasons Why caused quite an uproar and debate about whether to let your child watch. What does the panel think of the series, and do you think it would be harmful for a preteen to watch?
And I'm going to interrupt you here because it's getting ready to come back out. I don't know if some of you are aware, but in a few weeks it's coming out, and the series itself is already putting out promos, trying to discourage, well, to give some education, I guess. So go ahead.
Well, first of all, how many people watched it? Anybody in here see it? Okay, good. I'm glad some have. You know, I had kids start talking about it, so I went back and I did a binge watching after I first started hearing it, and I watched all 13 seasons. Episodes rather. I really thought, personally, it was a very accurate display of what I see in reality. We would all like to think things went by theory. We'd all like to think as parents, we're doing everything we can and everything will go right. But I think the movie depicted that you can be doing the things you think are right. You can be involved, and things still go wrong. I think it was very accurate in terms of some of the bullying that goes on that we don't talk about and we don't know about sometimes. It was accurate in terms of the drinking and the alcohol and the drugs that teens use sometimes that we are not aware of. I think that for a parent, I would not allow a preteen to just watch it without me being involved in it. You would want to be involved because it's a great movie for discussion. It is a great, this is reality. I would like to think, you know, if we do this, but it doesn't happen like that. It was very sad, yes, and it's not a movie, a series just about suicide. It's about lives of teens. Now, sometimes there's different extremes within our community. You know, I don't think some of the things that happen is going to be quite accurate for us as African Americans in the way they happen, but it does happen. And I think that we have to watch to understand what is happening in situations that we don't see. A lot of people say, well, it promotes suicide. I don't see it promoting suicide. I think it's really sure. Also, sexuality was another big part of it. We won't talk about those. Those are real issues. Those are things that are happening that you can see or you can choose not to see. but it's happening. And everything in all 13 of those episodes, I see it in real life. So it was very accurate for me in terms of what I see and what I have seen in my years of practicing. But I'm not the only one up here, so everybody has different opinions about it, and that's okay, but I just felt that it's a great movie for a point of discussion where we can really take it and look at those issues and break them apart. Even the counselor within the school system, what happens sometimes? And it happens.
Dr. Ford, I know with the school district, there was some issues with it. You guys put out information, did you?
I can share my mic.
Yeah,
I can
here.
share my mic. I'll share.
Yeah, I think that, thank you for that. We did have some issues with it in the school system, and I know that the series is rated for, I think, 18 and up to see, and so sometimes what happens is this goes back to monitoring of digital media and online shows with our children having access to iPads and computers, and they're streaming. They're not watching TV like we did when we were kids. They're online and they're on a screen. And so there have been a lot of documentaries that talk about screen usage with our children. This goes back to just looking at and supervising what our kids are doing and being nosy parents. And there's a term that I like to refer back to. It's called being tethered. So if you're on a boat and you've got your float tied to your rope, you don't untether from the boat. So you're the boat and your child is the float. And so you stay tethered to your children and you stay present in their lives so that they can understand that you're there for them and you're watching them. And so part of that, for me as a supervisor of counselors, school psychologists, and social workers, when our students began watching that and streaming that, and these were under the recommended age for the show, we saw a number of referrals that increased in my department. So much so that if you're a Fulton County parent, last year when the show came out, you received a message from me, from the district regarding that, and making certain that parents are aware of the show, because many times parents weren't even aware of the show and their kids were streaming it. So being aware of the content, if you do allow your children to watch it, is very important, so that you can have an authentic conversation about it. And even though the show, I think, portrays reality in many cases, it certainly doesn't place the role of helping professionals in a positive light in some circumstances. And while that may happen, what I want parents to know is that we're here for your kids, and we don't want that message to be permeated to you all. And I can just tell you from my experience, we did see an uptick in risk behaviors that were reported in the school system. And so I think it's so important to be critically aware, especially now that the new series is coming out, about the content, and that it's not something that you want your child to view unsupervised.
Dr. Sherry, you wanted to add something real quick, and then I wanted
to add a comment, because the increase in referrals, I think that's positive, because for the first time, somebody's thinking about harming themselves, or somebody's thinking they know they need to tell someone that they know someone is harming. So that's not alarming to me that there's an increase in terms of referral, because that means somebody got the message that you got to get help.
Right. So that is good. That is good. I want to move on real quickly so that we can get some more questions. Dr. Sims, you have a question. Do you want to go ahead and read?
Sure. I don't think mine's working. The question is, since children learn from their parents and some parents suffer from mental health issues, how do we encourage parents to seek mental health services to influence their children? It's a great question. It makes me think of a major issue in behavioral health, behavioral, emotional, mental health treatment, and that's stigma. We've been talking about it a bit up here. Just want to take a moment to put it front and center. We need to continue to break down the stigma that's associated with seeking help for these conditions. These conditions are a part of life. Many of us in some way or at some point in our lives will struggle emotionally, and there's nothing wrong with going out and getting help. And it's important, as this question suggests, it's important as adults and as parents to seek help and to model that behavior for our children when we have our own struggles that we're dealing with. So one way that we can encourage our parents to get help is to talk about mental health in mainstream media, in forums like this, to make it a part of our dinner conversations, to make it a part of our social conversations, rather than try to, push things under the rug and try to hide things. Have conversations with your peers. Talk about some of the struggles that you're having and some of the help that you've gotten, and share experiences with people. The more we do that in our culture and in our society, the more likely adults are to feel comfortable with asking for help. Now, I don't know if a parent or a child wrote this question, so if I'm a child and I think my parent is having some emotional struggles, hopefully you have a loving, close relationship with your parent. Maybe at dinner, sit down and say, Mom or Dad, I noticed you've been kind of sad, you seem kind of depressed. I was just at this wonderful forum where we were talking about behavioral health, and they suggested maybe you should go talk to a counselor. Maybe you should seek some help. If you have a brother or a sister or an adult peer who you think are struggling emotionally, have that conversation with them. Encourage them to get help. That's really the best we can do, is to have those conversations with people. You can't make adults do things. Now, the good things about being a parent is we can make our children do some things. We've talked about that today, using your role as a parent to make that child go and get the help that they need. Let the healthcare professionals figure out how to break down those walls and have those conversations. But we really need to have those conversations. I think ultimately with repetition, with follow-up, you'll break through.
Thank you very much. I'm going to let you, Dr. Johnson, answer the final question, and then we're gonna need to wrap up, because there are behavioral health professionals out here that I want you to get a chance to talk with. And maybe it's possible, and I'm putting this out there, Dr. Ford, that we can answer some of these questions, and I'll say that my department will put them online for them on our Fulton County Schools website, so that if you need some answers, that you'll be able to do that, and that's fultoncountyschools.org. So Dr. Johnson, read your question and give us a brief answer if you could.
Okay, so my question says, how do you help parents who do not like their children to be labeled? Well, first, I don't know any parent who wants their child to be labeled, and so this is a very common issue. The way we approach it, I always tell my parents that the head is part of the body, right? And that we're not singling out the head in exclusion of the body when we're talking about the needs of the whole child. And we usually approach it from that perspective. This is the needs of your entire child. And just because he may have an emotional issue or even a mental health disorder, it doesn't mean that he is being labeled. Now, as hard as it is for parents to understand this and to accept it, it is a problem that's part of this child that needs to be addressed. And we usually approach it from that perspective. I have to tell you, when you are able to integrate behavioral health into primary care, when you're able to identify the mental health needs of the children in the context of the entire child, it does reduce stigma. It increases access, it reduces stigma. And so that's something that we need to look at more closely, that model where you look at the entire child as you're trying to deal with all the issues that impact their ability to do well. And so that's really our approach. In primary care at Hugh Spalding, primary care in the school-based health centers, wherever I work, I have a lot of focus on behavioral health, because I think it's probably the most important aspect of a child's well-being, apart from chronic health problems, apart from acute illnesses, apart from injuries. Psychosocial issues are probably the most important aspects of a child's development that we have ignored for many, many years, and that we've isolated, and that we've actually tried to treat in a silo and in a vacuum. And so we have to get parents to understand that this is part of the whole child, and that we're not targeting this child, and we're not labeling them. We're just identifying what's wrong with them, and we're trying to put into place mechanisms and systems that really impact their overall well-being, physically, emotionally, mentally.
I think that's actually a good place to wrap up, because that's what this is all about today, is talking about the fact that the head is a part of the entire body, and certainly we wouldn't be ashamed to tell people that our child has juvenile diabetes. So we shouldn't be ashamed to tell them that they have a mental health issue. As we wrap up, I want to get back to something really briefly, and that is we were talking about reporting things when we know that there's a problem. On your phone, you can download the Fulton County Schools app through Android or Apple. And on that app is something we have called Quick Tip. And if you know of somebody, and I want you to tell your children about this and to have them have access to the app, if they know about a mental health issue or any type of issue, violence or anything, we want them to report that through our Quick Tip app. We have been focusing on it in the last few weeks, dealing with safety issues in our schools and telling people to report something if they see something in the schools when it comes to safety. But we also, when somebody reports something on Quick Tip, it comes into our offices and it can go to Candace Ford's office, and then we can help with mental health issues. So it is anonymous, and we want you to be aware of that. So this Fulton County Schools app, and Quick Tip is the tip line for us, the anonymous tip line. So I want to say that. Please join me in giving a big round of applause to our panelists today. They gave up their Saturday to be here with you, and it's been wonderful information I hope you've been able to use. Thank you very much. And I think some of them may be around for just a second if you wanted to talk with them, but as I said, we'll take your questions and we'll have them answered and we'll put them online. Thank you for being here today.